welcome to South Carolina. Just like to give a little sub note here where my wife and I are both Michigan State fans.
Listen, I told the people in Michigan that, look, up and through the primary up there in Michigan, let's just put everything aside and just get along. Right. After all, I came down here after Clemson beat the Buckeyes a few years ago, and that's still rubbing us raw up in Columbus. So,
right.
Go ahead.
My question is, has to do with Obamacare, the healthcare system where the candidates have in their debates and their interviews have said that they're going to repeal Obamacare if they are elected to office. Honestly, to tell you the truth, for me, Obamacare ended up being a godsend because of my conditions and that.
Yes, sir. Go ahead. I'm listening.
I worked for a company in Michigan for 34 years before my wife and I decided to move down here to South Carolina. And moving down here, I continued working for that same company. But in the process, we found out that we could not transfer our medical insurance to South Carolina. In reviewing the options here in South Carolina in the South Carolina Health Pool, we found where the rates were in excess of $2,000 in that. So as we were forced to do, we ended up going with Obamacare because that was the best option for us at that time. What I would like to know is what are your specific inputs to what you're going to substitute for Obamacare if you're elected?
It's obviously a critical question, and it's a complicated answer that I do want to give you. We've got very good healthcare experts in our state. In fact, we took our Medicaid program that was growing at 10.5% and reduced it to 2.5% in the second year I was governor without cutting one benefit or throwing one person off the rolls. So we spent a lot of time on healthcare. First of all, the problem with Obamacare is it does not control the costs of healthcare. They continue to escalate. And if they continue to, the people that are going to be hurt are the ones that are going to be rationed, which are going to be all of us, because we're probably not going to have the money to be able to evade that. Secondly, health insurance costs in my state have gone up by an average of 80%. So to make healthcare more affordable, how do you make it affordable when the costs are going up through the roof for the insurance? And finally, it's trapped small businesses who don't want to get caught in the web of Obamacare. So what would I do? Well, I take some federal resources and I combine it with a freed up Medicaid plan to continue to cover the working poor. We can't eliminate this and have tens of millions of Americans without health insurance. And by the way, if I'm president, a pre-existing condition will never be acceptable to deny you health insurance. That is un-American to take people off because they got sick. That's just a ripoff. But here's the larger plan, and we're actually doing this in our state, and I would like to take it nationally. You see, we don't know how our hospitals really do and what their costs are, and we really don't know how our doctors do or what their costs are. It's easier to interpret the Dead Sea Scrolls than it is a hospital bill. Did you ever figure that out? So what we want to do is total transparency. How's a hospital do? What's its quality? What's its readmission rate? What's its infection rate? And by the way, with physicians, you say you're good. What's the quality? What's the cost? And what we're doing is we're releasing all this information. We know some charge a lot. We know some charge less. And right here is the midpoint. And what we're saying is if you can provide quality to a patient, whether you're a hospital or a healthcare provider, below the midpoint, we will give you a financial reward if you're providing quality at a lower price. You see, we want to get the market into driving, first of all, your understanding of the system, your ability to make a choice, and a constant effort to deliver high quality at a low price by giving people financial rewards. If your primary care doctor keeps you healthy for the year, why not a little bit of a reward? And that's the way we're designing the system. We're doing it in Medicaid. And now the healthcare insurance companies are beginning to say, in an effort to control costs, because think of your deductibles, they're almost as high now as having a catastrophic plan. So we have to get in the business of high quality at lower prices driven by the marketplace. And this isn't a theory. This is not some political theory. We are about to actually make the payments next year based on quality and low prices, and most of our healthcare systems have participated in this, including the Cleveland Clinic.
Governor,
So thank you.
let me ask you,
Yes.
let me follow up on that. You're the only Republican left in this race who accepted Medicaid financing for your state.
Yeah.
Do you regret that? Because you've been criticized. You've been criticized by your fellow Republicans
Listen,
for it.
we drove the cost of this health care, of this Medicaid program, to like 2.5%. The whole country would like to have a rate like that. And how did we do it? We said that if mom and dad want to stay in their own home rather than being forced in a nursing home, they ought to be able to do it. Once we stabilized the program, I had the opportunity to bring these dollars back. And Anderson, here's the deal. If I treat the mentally ill, I keep them from living in a prison at a $22,500 a year or sleeping under a bridge. We owe our mentally ill better treatment than that. Secondly, if I treat the drug addicted, I keep them from being in a revolving door of in and out in prison, and maybe even breaking into our cars to support their habit, which they can't control. So we actually have the rehab people in the prisons, release them into the community where there's more resources, and our recidivism rate is 20%, which is like miraculous. And then for the working poor, what we know about the working poor is they don't go to the emergency room until they're sicker and more expensive. And we think that 1/3 of those working poor were people who had very severe illnesses, including cancer, who put off treatment. So this has worked out great for us. And we're saving money, and we're giving people an opportunity to be able to get their lives back. And I think it's been terrific. And I said if the federal government monkeys around with the formula, we'll withdraw from the program. But you know what's beginning to happen? Everybody's saying, well, wait a minute. If you can treat the mentally ill, if you can help the drug addicted, and you can help the working poor, why wouldn't we be doing that? And they don't have to do it my way. Each state should do what they want to do. But if you're not going to do what I'm doing, then tell me what it is you're going to do.
We're going to take a short break. We have more questions from our audience for Governor Kasich when we come back. You're watching the CNN